This is the last video for the common dental indices. So we're going to look at some other indices that are out there, and then we're going to wrap up this and do a little summary in terms of kind of what these indices look like. So some other indices, the biggest one is the Basic Screening Survey, or the BSS. Sometimes we also see it called the Screening Training Project, or the STP. This was developed by the ASTDD, which is the Association of State and Territorial Dental Directors. So it's a public health group. And basically, they developed the BSS to gather community level data, and not only for oral health status, but sometimes even access to care data. This is a very, very easy index to use out in the field, and because it's so easy, a lot of times you can train non-dental people to utilize the Basic Screening Survey as well. You would have to have a calibration program. You would have to train the non-dental personnel, but it is definitely possible to be able to use like public health nurses or even medical people to collect this data in addition to dental people, simply because it doesn't require as high of a degree of clinical judgment. This BSS gathers information on a per person basis and not a per tooth. So basically what that means is that as a researcher, I would look at a person's mouth for something specific that I was interested in. And if that person has it, then I would mark them in the yes category, and then I would move on to the next person. And then I would evaluate their mouth, and then if that person has it, then they would go into the yes category. Then I would go to the third person, and then I would evaluate their mouth, and then if that person does not have what I'm looking for, then I would put them in the no category. So the Basic Screening Survey, the BSS, is a dichotomous index, meaning you're just looking at whether there's a presence or an absence of a certain oral condition. So some case definitions. Caries. So typically the caries is going to be, this case definition is just going to be in, this could be either adults or kiddos. So you're looking at whether they've had a loss of tooth structure of at least a 0.5 millimeter, and if they have a brown discoloration of that tooth structure around that cavity wall. So if they have both of those, then you can mark them in the yes category and then move on. The caries experience is for children only, and basically what you're doing is you're looking for active decay, or if they've had a filling, or if they have a permanent molar that's missing due to decay. So if you look in there, like if I was going to a classroom, my sister-in-law's an elementary school teacher, so if I was going to go to her classroom, let's say she has 20 kids in there, I would look in kid number 1's mouth, and once I saw a filling, I would mark them in the yes category and then move on to child number 2. And then I would look to see if they had any untreated decay or filling, or if they were missing a molar. And if they were missing a molar, then I would do a little bit of investigation in terms of why they were missing the molar. This really provides a lot of information on a personal, quote unquote, personal level, because at that point you can actually kind of give a prevalence. You can give a percentage of how many people have that certain condition. So let's say I'm utilizing my sister's and my sister-in-law's classroom again. I could say, Jody, you have 50% of your kids have active decay in their mouth, meaning 10 of the 20 kids have active decay, if that's what I was looking for. So it really makes it really easy data to digest, even for non-dental people. Some other case definitions, some things that you can look at, whether school children have dental silence present. So you're basically just assessing their permanent molars and if they have a silent present. And if they have a silent present, then you're going to mark them in the yes category and then move on. If they don't have dental silence, then you're going to mark them in the no category and then move on. You can also use the BSS to assess early childhood caries. And it used to be through the age of 3, but we know that that definition has changed through the American Academy of Pediatric Dentists. So you could even do it through the age of 6 now. But you're basically looking at the 6 anterior teeth and seeing if they have a decayed tooth or a missing tooth or a filled tooth due to caries. That's kind of the older definition of early childhood caries, but you can modify that case definition to include the new definition from the American Academy of Pediatric Dentists. You could also use the BSS to look and see edentalism, or whether adults have their natural teeth or not. So if you look and see if they have one or more of their teeth present, then they would go in the non-edentalous category. If they're completely toothless, then they would go in the edentalous category. So it's a really an easy one to use out in the field. They actually use the BSS to do the kindergarten screenings in the state of Kentucky. In the state of Kentucky, it is quote-unquote mandatory for any entering child that's entering into kindergarten to have a dental screening by a dental professional. And they have paperwork that you may be asked to fill out so that a parent can turn that into their school. And basically what you're doing is you're looking to see if they have any decay or any kind of dental problem, and you fill that portion out of the paperwork. But another part of the paperwork is that you can actually say whether they need treatment right away or if they just need routine treatment. So this is actually what it looks like on the kindergarten form. And you can classify the kindergartner how urgent their treatment needs are. Do they not really have any obvious problems? Or are you going to circle a one where they need early care because you saw maybe a little bit of carious lesions, or maybe you saw some gingivitis or something going on? And then, or you can circle a number 2 where they actually need to get in. They need to get in today for urgent care. So like within the next 24 hours, they need to have some type of dental intervention because they have pain, they have an abscess, they have some infection going on, or an ulcer that has lasted 2 or more weeks. So we'll actually, in Kentucky, we'll actually classify each kindergartner based on their treatment urgency on that paperwork. And that's based on the basic screening survey that we do. Some other oral conditions, oral cancer and cleft lip and palate are usually measured as a rate. So, not anything fancy in terms of the different indices that are out there. We're just actually counting the amount of oral cancers or cleft lips or palates that are out there. And then with fluorosis, we do actually have an index, but it looks a lot different than what the other indices that we talked about in the different videos. And the most common one is the Dean's fluorosis, or the Community Fluorosis Index. And it's a 6-point scale, and it's actually nominal. So we're going to classify a person as either normal, or maybe they have mild fluorosis, maybe they have moderate fluorosis, or severe fluorosis. So what you do is basically you look at for the worst two teeth in the mouth, and you look at the worst two teeth, and then you categorize them based on those 6 nominal categories. So let's say if you were looking at the third picture over from the left, the 2 worst teeth would be, it looks like 8 or 9 here, 8 and 9 here. So we look like we have some brown stain. We also have some pitting of the enamel. And it looks like pretty much all the enamel surfaces are affected, maybe not the gingival third up there, but it looks pretty severe. So we would classify that as a moderate to severe case of fluorosis. So you can see we have normal, we have questionable, we have very mild and mild, moderate and severe. Most of the cases of fluorosis are going to be in the very mild to mild categories. So, in summary, most of these dental indices are ordinal. This has popped up on boards before, so this is something that I really wanted to point out. And that just means that we're really rank ordering the severity of the disease. And again, like I said, the rule of thumb is the lower the number, the less severe of the oral disease that we're looking at. The higher the number, the more severe oral disease that we're looking at. So we're rank ordering them, but typically we can't really do any kind of data analysis or number crunching on these indices. The exception would be the caries indices, and specifically the DMF index. With the DMF index, this is actually an interval ratio level index. So all of them are ordinal with the exception of the DMF, and that's an interval ratio level index. When you're studying incidence, and remember, incidence is you're collecting data at 2 points a time. So if you were doing a DMFS type of index and collected that for your pretest, you have to make sure that you use the same index and the same definitions the second time around so that you can collect the same type of data, and you won't introduce any type of confounding or conflicting variables in there. So these are our dental indices that are out there. I know it's a lot to wrap your head around. It's a lot in terms of knowing information because it's all brand new. Don't get stressed out about it. Know those rules of thumb that I keep repeating throughout these videos. And eventually when we get back into the classroom, I have an exercise where we'll actually utilize some of these indices on typodonts. So it may help to clarify some of those, how to utilize these in community setting type of questions. I tried to find some videos on utilizing the indices out in the community, and honestly, I didn't find anything out there. So make sure to review these PowerPoints and know about the indices, and we'll keep talking through it in terms of how to apply it and kind of what that looks like. All right. We'll see you next time. Oh, sorry. This is your exit ticket information. So go to this website, and your room number is CDH1 Lecture 6.